Ladies and gentlemen, welcome once again to the Think Clinical podcast. My name is Hamza. Over the last couple of weeks, it's been exciting. It's been amazing. We've been looking at just the journey from clinical practice into the healthcare space, what you need to consider in terms of your mindset shift, all the things you need to look at in terms of what alternative careers are out there for you. And today we'll just look at what we call how you can find your niche, how you can find especially in the context of healthcare businesses, how you can find like a specific area in healthcare that you want to focus on. So it's like a specialized area or a specialized market segment that your business wants to target. Because, and I will walk through the advantages of just choosing that specialized area where you want to target instead of everything else. Some people go in and do everything that they can do under the sun. That's what most people, over 90% of healthcare businesses, just go in and they do everything. A few people are beginning to identify the need to go into highly specific or highly specialized segments, because that's the way to differentiate yourself from other competitors or other people already in the market. Mind you, you are going in there to compete with people who have been doing very broad medical services for over 30 years, for over 40 years, for over 50 years. They have their core patient base, and they have a patient base that probably is generations have dedicated their health to these institutions. So you're not just going to walk in there with a broad idea and take these people away, because there's no value, there's no unique value proposition there for you. So a lot of people now coming into a healthcare space are looking at niche markets, are looking at highly specialized market segments where they can take advantage of an increasing need in a specific segment or the specific market and providing services to that market. For instance, elderly care. So there are a lot of elderly care homes that are coming up now. There are a lot of people who are opening hospitals that is specific for taking care of the elderly. We have people who are focusing just on mental health now, because mental health is becoming very big and people are becoming increasingly aware of the need to take care of their mental health. So these are people just come into the market and that's all they want to focus on. So when you specialize in a field like that, you build a reputation of excellence in that field. So finding your niche or that specific segment of your healthcare business or the healthcare business landscape that you want to focus on, it speaks to that segment on your ability to provide that excellent service within that market segment. So let's look at some advantages of why would you rather go in for a small segment and focus and be the best at it than going in broadly to do everything that everybody does. One is that it gives you a competitive advantage over a broader healthcare business, because you are carving your services to meet unique needs of patients. Now, whether you accept this or not, patients want to feel that whatever problem they are bringing to you, you are in the best position to be able to offer them the solution to that problem. Now, niche markets actually help doctors appreciate the fact that this is it helps patients appreciate the fact that this is a doctor who actually has taken his time to learn about my specific problem and is well and better positioned than the person offering broader services to give me that service. So for instance, someone has a heart problem. They can walk into a big multi specialty hospital and see a cardiologist. That's one option. Or they can walk into your clinic, which is solely dedicated to cardiology. Now the difference between those two is that in their minds, by virtue of where they map you in their minds, they map you as a practice that solely does cardiology and is known for only cardiology as demonstrating excellence and more knowledge in that field than someone who probably has a cardiology unit in their big facility. Now there is a competitive advantage there, regardless of what you say. There is a competitive advantage between the two, but it's also helpful for, again, you to position yourself and demonstrate that ability to offer that special care before you can enjoy that competitive advantage. The second one is you have the ability to charge higher prices. So if I'm walking into a hospital that mainly does foot surgeries, for instance, the tendency for me to agree to higher charges or to pay higher charges for such a niche market, because I believe, again, to my first point, that they are excellent in what they do and that's all they do, is higher than me going into a multi-specialty hospital and being asked to pay the same, and probably going to be done by someone who is not specifically a foot surgeon. So again, that niche marketing helps you to be able to, in the mind of your market, help people identify that, okay, you are the best in what you do. So obviously they should be willing to pay a bit more than what they would usually pay if they were going for the same service in a place that is not known for that particular service. So again, it gives you the ability to charge higher prices. The third thing is that it's more of a targeted marketing approach. So you are not just going after everybody, you're going after a specific age group. Let's say if you're talking about the elderly, you're looking at a specific age group, you're looking at a specific population, you're looking at people with specific demographics that you are going to be picking up. So you're not just throwing a wide net out and hoping that it catches whatever it catches, then you take it in. And that actually helps you with the targeted marketing to be able to get more return on your investment than just doing that broad marketing. The fourth one is it increases your efficiency. So if you are doing the same thing and that's the only thing you want to specialize in and you know how to do it very well, you're not focusing on how to make your child care unit efficient. You're not focusing on, at the same time, focusing on how to make your ops unit effective. And also at the same time, you're not focusing on all these different things. You're focusing on one. You're focusing on how to make your ops efficient. How do I make the journey of that pregnant woman from the time they walk into my door, maybe just realizing that they are pregnant in the early stages? How do I make that experience, that 9-month journey, how do I make it memorable? How do I make it so that they go and they come back to me and say, I want to do this again with you? So in other words, you are focusing on just one area and you continuously clean up and make it more efficient in such a way that you get to a point where you actually own your craft. People come in there and they see you running a well-oiled machine. The fifth thing is that it's easy to scale when you have a niche market, because now, as I said, you are not looking at multiple areas of specialty or multiple areas of stuff that you are going to be scaling on. You are going to be looking at one thing that you're scaling on. So how do I increase my antenatal visits? How do I increase and keep people in my antenatal visit? How do I keep people and actually have them deliver in my practice? What other services can I add? So it's easy for you to focus because you are really focused on one area, so it's easy for you to scale. And added to that, you have a greater innovation potential because, again, you're focused on one area. So creating a niche market is tricky. It's tricky because if you don't pick the market that actually has the need, you are going to be running a very, very unprofitable business. But then if you're able to identify that niche market that has the need and you have the space to provide or meet that need, then it changes the whole narrative. The third thing is, and the other thing I want us to talk about is now, if you know the advantages of a niche market, how do you create one? How do you find your niche? How do you just sit back and say, okay, this is what I need to do? And as you can guess already, it starts with you identifying what you're strong in and what your passion is. So I'm a general surgeon. I'm good at general surgery. Anything if I'm going to create any niche market, it's going to be around surgery. I'm also good at IT, healthcare technology. So anything I'm going to pick is going to be around healthcare technology. So as soon as I start thinking about my niche, I'm thinking about what my strengths are. I like and I understand healthcare technology. I like and understand surgery. So what within these two, what's that sweet spot between these two that I can explore in order to create my niche? The second thing is that then once I identify these two, that okay, these are the two things I'm good at. I'm a surgeon and I'm a healthcare technology person. I'll need to the second step is to go into the market and look at the trends. between these two, or with the two combined, how are people accepting healthcare technology? How are these healthcare technology companies growing? What's the adoption rate? What are people specifically doing? What is the market saying about these technologies that are coming up? The same thing for surgical services. What are people saying about these surgical services? What are the pain points that they have? Again, that is why you have the ability to meet the customer's needs. They may be getting about 80% of services or their expectations met, but that 20% makes a big deal for them, and it means that 80% is something that anybody else can offer. But what makes you different is your ability to tap into and offer them some, if not all, of that 20% that they're expecting. So then again, your aim in doing this is to make sure that you're identifying or researching the market to find items that you can offer that exceeds the expectation. Then the word is to exceed the expectation of the patient, and that's the only way you have people coming back to you. Then the third step is to assess competition. So obviously you can't just jump into it because there's a need for it and you think you're strong in it. It could be a very congested market. So general primary care offices or general private hospitals who do everything are now becoming, like especially in Africa, are becoming very common because everybody goes and they do the same thing. So if you're going to go broad, do the same thing. But if you're going into a niche market where, let's say, you're opening a cardiology center, this cardiology center now serves as, okay, this is the place where there's a need. I check the market, people have a high demand for cardiology services. These are the pain points people have when they are going in for cardiology services or staying on their treatment regime in cardiology services. These are the pain points they have. I have a solution to those pain points. So I move on to the third step where now I look at how many cardiology offices are in this area or are in this country. What's the spectrum of services that they offer? Am I going to a crowded market or a market where it's not so crowded that I don't have to spend so much in patient acquisition? What does it look like? And then now, once I'm able to establish that, I have to look at the resources I have. How much money do I have? How much money am I willing to invest in this, based on all these different things, based on the needs of the patient or the needs I've identified or the needs in the market, based on competition. This is how much, what are the resources that I need? Do I have those resources now? In terms of financial, in terms of personal, do I have the right people to help me scale this? Do I also have the technology to help me scale this if I need to? And then if I'm able to answer these questions and they are correct, then I have to build a business plan. And this is something most people do not, and small businesses, I've had issues with a lot of startups where I've always said, at the end of you answering all these questions, you need to build a business plan, because this business plan actually tells you how you're going to get this done. And if you're not able to clearly articulate how you're going to get this done, then you don't have a business here. Now, let's look at just 5 niche markets that have been very successful in the last 10 years. The first of it, without even missing my words, and because of COVID, is telemedicine. Telemedicine had always been the background. We started telemedicine's company in 2014. We were not very successful because the timing was bad. The timing there was no demand in the market at that time for it, even though we knew that this is something that could be instrumental when things like a pandemic came in. Now, when the pandemic struck in 2020, there was a huge demand for telemedicine, and this telemedicine has stayed with us after that, and it's still growing. That's the first niche market. The second one is medical device and equipment. It's still like people are going deeper and deeper. Some people just focus on maybe doing only implants for maybe for dental offices, implants for maybe orthopedic surgeons, and even sometimes when they go into that space, they look at just hip implants. They just look at specific areas. They choose a very small area and they just focus and they perfect it and they make it so good that if you need any replacements for any part of your body. You know specifically who is the best at that part of your body. So that's the second one. Third one is in healthcare IT, which is getting bigger. You have electronic health records now. You have AI, which is really whether we like it or not, it's going to come into the healthcare industry. So we need to learn how to leverage and use it better. And then we have personalized medicine or precision care, where now people are tailoring care to the basic genetic needs or the basic genetic makeup of individuals, and that's where healthcare is getting to. And we have health and wellness coaching, which is also becoming a very big side. These are the 5 big niche markets that have popped up in the last 10 years, and there's more going to come up. It depends on how you conceptualize and go through these steps that I'm mentioning for any niche. There's so many other things that we could be doing that we are not doing yet, that you could be the one to explore them first. So again, once you decide to go into healthcare business, my personal recommendation is we are getting into a time where you don't go into that business thinking broad. You need to think very specific and very narrow to what you do, and have people identify and acknowledge you to be the best in that field. And that's the only way you can come out above competition and be able to succeed. Once again, another very interesting episode of the Think Linker podcast. My name is Dr. Hamza Asuma. Please remember to subscribe, like, and share, and we will see you in our next episode. Do take care.